You're watching Good Morning Uganda. I'm Olive Monica Najuma. Thank you for sticking with us. Now, Uganda and even neighboring countries have heightened surveillance across the borders due to the rising cases of monkeypox. Now, many districts, Kampala inclusive, have recorded some cases of monkeypox. So it begs for the question, how bad is the situation? But also, we need to acquaint ourselves with how the symptoms look like and how dire the situation can get if we do not employ standard operating procedures. And it's because of this that we are going to delve into the conversation regarding monkeypox. How bad the situation is, can it be controlled, or is it already out of control? Though I know it's not yet out of control because we have only registered a few cases as a country, but I have Dr. Bonnie Chintu, who is the Senior Medical Officer, Surveillance Department at the Ministry of Health. He will take us through the situation of monkeypox, teach us more about its symptoms, what to look out for, how to avoid getting in contact or how to avoid being affected by the same so that we know how best to safeguard ourselves. So stick around because this is going to be an enlightening conversation. Good morning, Dr. Bonnie.
Yes, good morning, Monica.
You're welcome to Good Morning
Thank
Uganda.
you so much.
Now, I would like for us...
And good morning to our viewers out there.
All right. Dr. Bonnie, I'm happy to have you because everything I know about monkeypox is something that I have found in the newspapers. So for me, it's important to have an expert tell us more about this disease and how bad it can get. You see, at the onset of COVID-19, as a journalist, when the first cases of COVID-19 I saw in the papers, I never took them seriously.
Sure.
I never even bothered to report about them at the start.
Okay.
Unbeknownst to me, and I think the entire media fraternity and the world at large, this was something that was going to bring us to our knees in just a few weeks. Sure. So now we have monkeypox. The pictures I've seen are scary. Okay, it is, I've had chicken pox in the past, but I think this is worse than chicken pox. Sure. So give us the general overview to start with of monkeypox in the country, how bad it is, and basically the general overview to start with.
All right, thank you so much. And you're right to say that you've seen some of these pictures in the media, and I know how perhaps scary these have been. And I believe what you've seen and how you've felt is actually a reflection of what is happening deep down in the communities. But maybe just to give a brief overview about monkeypox. Monkeypox is a viral disease, and it's a disease that we've had in the world since 1970. This disease was first detected in our neighboring country, in DRC, and from then to now we've had few cases, if I should say, but over the last 2 years we've noted globally that there's been an increase in the number of cases, and again the biggest contributor to this big number of cases in terms of countries is our neighbor, again DRC, and because of that we've had cases spread to not just DRC, but to countries within Central Africa, within East Africa, and within West Africa. But we've also seen cases going up to continents that are outside Africa. Yes, and basically the way this thing presents, one, it's a viral infection that's caused by a viral pox. So it's maybe in terms of naming and nomenclature, internationally, the name was also changed, I think sometime last year.
To Mpox. To
Mpox, yes. And the way it presents, as you've rightly mentioned, is that one, people that have gotten the infection usually get the rash that you've talked about, and this rash characteristically is similar to chicken pox, as you mentioned. Though sometimes the blisters that we see in monkeypox are much bigger, yes, if it's severe. But also in terms of coverage across the body, yes, it covers most of the parts of the body. Okay. And in addition, patients will also present with other symptoms like high temperature, which is fever, and body aches, headaches, joint pains, and all those other symptoms. And in case it's complicated, sometimes it will present with other symptoms. For example, cough, pneumonia, and some of those other symptoms.
Okay.
But also maybe quite important to notice that sometimes these blisters, as we've mentioned, can go to areas that we may not see blisters. For example, when you have chicken pox, like the mouth and the eyes.
Inside the mouth?
Yes, inside the mouth. Yes.
All right. I think the picture doesn't get after Dr. Boni painted it clearly for us, but it's important for us to understand what we are up against. So join the conversation. You can send in a few questions and queries regarding mpox and its outbreak in Uganda and other East African countries. You can reach us on WhatsApp number 0709 602 592. Please leave your name and the area where you are texting us from. You can also send a direct message, and by all means, please do not call. Now, Doctor, coming back to you. First of all, let's talk about nomenclature. There is this thing about monkeys that is wreaking havoc across the world, and we'll never forget COVID-19. It was said it originated from there. Now we have mpox. Does monkeypox come from monkeys?
As the name suggests, monkeypox is caused by a virus that is known to spread to humans from wild animals. And particularly the animals that have been held culpable are monkeys. There's a certain species of monkeys. And as well rodents, and when we talk about rodents, in our general understanding, we're talking about rats.
Yes.
Yes, especially wild rats. Yes, so it's known that these animals have been the sources of infections, even from way back from the 1970s, like I mentioned earlier. So it's these animals that have been the sources of infections that have come and spread to humans. And outbreaks that have been noted in the past have mainly because of this spread from animals to humans. Of course, because we interact closely sometimes with some of these animals. But as we know, especially in rural communities, where people stay quite close to areas where these animals are, like forests.
To their habitats.
Yes, it's very close for them to interact with the animals, and sometimes they pick these infections from the animals. And this is not just in the spirit of mpox. There's quite a big number of diseases that we are seeing recently, and most of these are attributed to spread from wild animals, and of course it's because of our close interaction with these animals.
So by close interaction, I would like for us to clarify something, because people claimed at the peak of COVID-19, people claimed someone from a certain region went and decided to eat a monkey. So I would like for us to clarify, by close interaction, does it mean animals coming in close contact with people, or people also feeding on the meat of these animals?
Yes, and thank you so much for that clarification. So it's actually what you've mentioned. So in some communities, we know that people eat these animals. Yes, so it can be from eating the animal, especially if you eat the meat when it has not been adequately prepared. But it's not just about eating the meat. Even getting in close contact with the animal can put you at risk, because the way this virus spreads, it can spread. So for example, if you have it, I can pick it from you through direct contact. If our skins rub, for example. And
that's where I was going. How is the virus spread, especially for us who are not even in close contact with the animals? Okay,
so in case someone picked it from the animals and perhaps they are within our community, we can pick this disease or the virus from them through different ways. And as I mentioned, the first way can be through direct contact. That is, if we get into close contact, where maybe our skin gets into direct contact with their skin. And this can be seen through our day-to-day practices of hugging, kissing, but also if for a person that is taking care of a known patient of mpox, in case they get into contact with the beddings and sometimes the clothes of this patient, it can be a risk for them, and they pick the virus from them. But also, as you remember with COVID, there's that spread as well through breathing. We call it through respiratory droplets. But if I'm in too very close contact with you, I can pick the virus from your breath.
Okay.
In simple terms. But as well, if I have the virus and I touched somewhere, you can as well pick the germs from the surfaces where I have touched. Yes, so the spread is both through direct contact, but it also has that element of, I know people remember a lot of COVID, so
yes.
Remember COVID was spread through, again, breathing
yes.
Directly into someone's face. But also remember the issue of surfaces, picking the virus from surfaces.
And touching soft parts.
Yeah, exactly.
Okay, and we will get to the SOPs that we need to employ. But first of all, I'd like to know who are the most at-risk people here when it comes to Mpox?
Yes, and maybe just before I answer that, there's one important mode of spread that I had not alluded to, and this is sexual contact.
Oh, yes.
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 So if you have direct or unprotected sex with someone who has the virus, you can be at risk of picking the virus. Can
protection help with it? Because we know that even sexually, there are a few infections that are not protected by the use of condoms.
Yes, so through that route of sexual, it can be protective, but as we've seen, the spread is not just sexual. Yes, because it can be through, again, this touching and and the kissing.
And,
yes, so you may not get it if you use protection, but you may as well catch it through these other forms of interaction.
Okay. So, Doctor, who are the most at-risk people?
Yes,
because what I know right now is that there has been heightened surveillance at our borders.
Sure.
And the truck drivers are now complaining that they're taking way more time at, let's say, border crossings in Busia and in Malaba because of these heightened surveillance and health checks.
All right. And for me to answer that, based on the way it's spread, I should say that we are all at risk.
Yes.
Okay? And maybe what I didn't mention earlier is that we've recorded, as a country, we've recorded cases in a number of districts now. Yes, there are a few districts where we've had cases. Of course, the first cases were detected from Kasese district. And of course, we know this is a border district between Uganda and DRC.
That's right.
Yes, so most probably these cases had contact with patients from DRC. But we've had cases in Kasese, we've had cases in Amuru. Amuru is also a border district between Uganda and South Sudan. We've as well had cases in Kampala, Wakiso, and
Nakasongola.
Yes, and Nakasongola.
Yes.
Yes, and again, because we are seeing these sporadic cases in different districts, that's why I'm saying that we are all at risk. And again, based on the way the virus spreads, which is through direct contact or even being in close proximity with someone that has the virus.
All of us at risk.
Yes, we are all at risk. But of course, there are those communities that we think are at higher risk. You've talked about truck drivers. We know as they're on their routes, they usually have stopover points, and some of these have been culpable for a lot of commercial sex workers. Yes, and from history, again, we know that these truck drivers usually have sex with some of those groups of people.
The sex workers, yes.
And because, of course, some of them travel from countries that still have cases, sometimes they can as well carry the infection into the country.
Okay.
Yes.
Okay, we are having a conversation regarding the spread of Mpox in the country. We've recorded a few cases. How many so far?
So far, we have about 11 cases as a country.
So far, we have about 11 cases as Uganda. Now, I'm having this conversation with Dr. Bonnie Chintu, who is a senior medical officer, Department of Surveillance at the Ministry of Health. So if you have any questions for him, let's have them through WhatsApp number 0709 602 592. Now, someone is asking, where did it come from? Dr. Bonnie has answered that question. He says it originates from DRC because of its forest cover.
It has it has a very dense forest cover.
Yes.
And there's quite a number of animals within those forests. But also the practices of the people in DRC, it is known that most of them consume this wild meat. Yes, and of course we know if the virus is with the animal and you eat the meat, it can be easy for you to pick up the virus from that.
Now, since there are a few, when it comes to mpox, I see some similarities with COVID-19, especially in terms of spread.
Yes.
Now, I remember the standard operating procedures of COVID-19, but at the same time, I don't think every Ugandan remembers. So when it comes to SOPs,
yes,
what are we supposed to do to protect ourselves, our loved ones, to ensure that we do not fall prey to the spread and maybe not come into contact with people that could probably have mpox?
Yes, great. And maybe just before I answer this, just allow me again talk about this.
Please.
So I mentioned that as a country we reported 11 cases.
Yes.
But also quite important to know is that we've not had any deaths as a country from mpox. And most of the cases have actually been treated and they've been discharged.
Okay.
Yes, so cases will present, but most of the cases that we've seen have actually been mild cases, and they've been managed successfully in centers that have been identified by the country, and they've been discharged back to their home and back to their communities.
How long does it take to treat mpox?
Again, it depends on the severity. Yes,
okay.
Yes, but averagely for us, mpox usually takes about 2 to 3 weeks. Yes, for you to get completely cured. And again, cure here is about you shedding off all the symptoms and the rash is gone and new skin has formed. That is when we think you're not at risk of spreading, and therefore you have as well cured. But again, maybe if I can answer the question of SOPs. So one is that government has come in full swing. As a country, we have put up measures, we have come up with structures that are going to enable us fight this outbreak of mpox. And in as much as we have very few cases now, I want to assure you and I want to assure the country that the government has come through with a fully fledged force in terms of implementation of control measures, both at national level, but also at subnational, district, and community levels. Yes, and one of the ways, again, that people can protect themselves is through, one, strict hand washing. Some of the measures are actually not different from COVID-19. Strict hand washing at all times, as we talked about, the virus being, it can linger around on surfaces. So if you touch anywhere that you're not sure, it's good that you routinely wash your hands, again with soap and water. If not, then you can use alcohol, the sanitizer. But it's also good to, as we know, as we heard that they spread through respiratory droplets or through breathing, it's also good that, especially if you're within a community that you're not 100% sure, you can as well wear a mask. And again, as we saw about the direct or unprotected sexual spread, it's good as well to make sure that as you're engaging in this, try to be protected. But also, if you can avoid, especially for people that you don't trust or people that you do not know their whereabouts, it's as well good to abstain from carrying out this activity with them.
Okay,
Yes.
that's going to be a hard sell. It's going to be, but for the sake of your health, you might have to consider that. Now, Dr. Boni, let's look at vaccination.
Yes.
Are there known vaccines against Mpox?
Yes, and again, thanks for asking that. So vaccination, as we know, is a very, very important measure, not just for Mpox, but for infectious diseases.
Yes.
And one of the greatest weapons that we have as a country, and okay, maybe not at country level, but one of the greatest weapons that we have at the global level is vaccines for Mpox. So vaccines are available, but again, because the severity of the outbreak at global level has increased in the recent past, vaccines were not available in a very good supply in terms of amount, but at least there's vaccines. We know there's vaccines available.
Do we have them as Uganda?
Okay, so again, as you remember during COVID, these vaccines are one, available in very small numbers, and I think as a continent, it's just DRC that has been able to benefit from this. I think
Because
about
it is the
a week.
epicenter.
Yes, it has the biggest number of cases and the biggest number of deaths, and of course, most of our cases have also come from there.
Yes.
Yes, so the leaders in health at a global level, that is WHO and Africa CDC and UNICEF and other partners, of course, usually come up with measures on how to apportion the little vaccines that we have at global level. And based again on the data that is available, it was thought prudent to give vaccines to DRC first. And about 1 week or 2 weeks ago, there were about 100,000 doses of vaccine that were delivered to DRC. But as a country, we are also pushing to get some doses of vaccines. In the near future, we're going to be receiving vaccines in the country.